How is follicular lymphoma diagnosed?
Follicular lymphoma is diagnosed based off a biopsy of a lymph node. There are typically three major ways that we can get tissue from a lymph node. One is called a fine needle aspiration, or an FNA, and that's when a small needle is taken and they essentially kind of suck out some of the cells and look at them under a microscope. That is not the ideal way to diagnose a lymphoma because it doesn't usually give us all the information we need. Then there's something called a core needle biopsy, where typically interventional radiology, sometimes a surgeon will often use an ultrasound or CT scan to help guide them get a biopsy from the lymph node. And it'll be what is essentially like a small chunk of that lymph node to look at the tissue. And then the pathologist does a number of different tests to determine the type of, if there's lymphoma and the type of lymphoma. Then there's also incisional or excisional, where there's actually a surgical procedure to either remove a lymph node or take out a larger piece of the lymph node for the pathologist to look under the microscope. Very occasionally, it may be diagnosed by a bone marrow biopsy, where a patient has low blood counts and somebody does a bone marrow to see what the area that's making the cells shows, and the diagnosis may be made that way as well.